Hi, I'm Stella O'Malley, a psychotherapist in Ireland.
And I'm Sasha Ayad, an adolescent therapist in the United States.
And this is Gender, a Wider Lens, a podcast dedicated to the shifting concepts around gender in our contemporary culture.
Through in-depth interviews, personal stories, and psychological exploration, we seek to open up the discourse around this hot-button issue.
Join us as we look at gender from a wider lens.
Hi, Stella.
How's it going, Sasha? This is our last interview.
It is.
Aww.
We have one more. I know. We have another episode coming up next week, but this was our last interview with a guest. And we really couldn't have picked someone better than Clementine Breen. We're so touched to have her today. She's a 20-year-old young woman who is detransitioned. And her story is particularly important because she was a patient of Dr. Johanna Olson-Kennedy, who is one of the most well-known advocates for early intervention, pediatric gender medicine. She received a $6 million grant to study puberty blockers. She's in, Los Angeles, and she is one of the most prominent gender clinicians out there. And Clementine began to see Dr. Olson-Kennedy along with a therapist she recommended at age 12. And as you'll hear, between 12 and 14, it was a very rapid succession of interventions. Puberty blockers recommended on the first session, testosterone, and then surgery when she was just 14.
And there's this incredibly forlorn image in the middle of it all. When Clementine is telling the story, it's just rolling along. And then she talks about she's in 8th grade, she's recovering from a mastectomy at 14, and she is not able to do the activities because it's a school trip and she has to sit it out because she's recovering from a mastectomy, and it just feels so wrong. It's like, this is just a baby who should be just enjoying school trip activities. It feels like she's a very good example of how fast-track pediatric transition kind of makes the child lose themselves, if you follow me. And she did lose her sense of self. She lost who she was. And, the impact of what seems like testosterone, it seems like testosterone-induced psychosis, which is a thing, seemed to really kind of blow her life out when she was about 15 or 16.
Yeah, so after her mastectomy at 14, she started to have a very severe mental health decline, including, as Stella mentioned, psychosis. And, she dissociated very severely. She began self-harming. She had a suicidal ideation and a suicide attempt. Really, really serious stuff. And lo and behold, the only priority of these gender clinicians is let's just make sure you keep taking that testosterone. It's really remarkable. I was familiar with the details of the suit, but it never fails to blow my mind. And, had she continued on this road around 17, Olson-Kennedy started talking to her about getting a hysterectomy, and she didn't do that, but that could have been right around the corner for her. So, you'll also hear that throughout her care, if you could call it that, she had very, very superficial kinds of, pseudo-therapeutic conversations. She was seeing a therapist, she was seeing a psychiatrist, but everything stayed very surface level. And it's not until she left the kind of gender identity therapy world that she started seeing someone in DBT when she was much older, and then started to piece together the puzzle. For example, some of the abuse that she experienced as a child, some of the very complicated kind of family dynamics with a brother who had a disability. So she started to piece it together much later in life, but she never got that opportunity when she was a kid starting to question her identity and her body.
Yeah, and there's a nice little story towards the end in the bonus content where you realize the power of love. Like when you've got another person on your team, I think you can face things, and it's really powerful because I've seen it with a few detransitioners now, and I think it's really beautiful that the person can fall in love with, and whether they look like this, they look like that, whatever their gender identity, they just see the person, and that's kind of beautiful.
Yeah. In the bonus conversation, she also talks a bit about her family and what this was like for them and some of the kind of mean and difficult things that they've also experienced in her coming out of this. I mean, it's really hard. These parents get it from both ends. Either like you're a transphobic bigot if you won't support this medicalization, and there's the suicide threat and all that. And then of course on the other end, how could you have done this to your child? I mean, it's really devastating. And you always do a good job, Stella, of pointing out the onus is on the physicians making
Yeah.
these recommendations.
Yeah. Johanna Olson-Kennedy has really not covered herself in glory. 1,200 patients and, a flippant cavalier attitude that people who have mastectomies can, get them later, buy them later with implants.
Mm-hmm.
I really think the more that we shine a light on these unthinking, mindless clinicians that are causing so much harm, they shouldn't be in this. They shouldn't be working with people. They should be in other jobs because it's just not right. The harm and devastation they have caused.
And I just want to say really briefly, and we'll jump into the conversation. This is not a one-off. This is not an unusual example. Olson-Kennedy has been very public about her disdain for mental health assessment and her desire to intervene as early as possible and her kind of across the board rubber stamp affirmation approach. So what happened to Clementine is just kind of one example of hundreds and hundreds of kids that have received this type of gender affirming care. And Olson-Kennedy is a prominent person in WPATH and in the gender affirmation world. So this is the philosophy. I think this is an example of how does this philosophy look when it plays out clinically. So we're very grateful for Clementine for her kind of honesty and sharing her story with us. And we hope you enjoy the last interview of Gender a Wider Lens. And we hope that we will catch you all in the next episode and in our live and unfiltered Substack events. Hi, Stella, and welcome to the show, Clementine.
Hello.
We're delighted to have you. I first saw you on Billboard Chris and you blew my head off, I'll be honest. And you could see Billboard Chris kind of looking at you going, whoa, this is some story. And since then, you've kind of propelled into a very serious position because of the legal case you're taking. So I'm really glad that we're getting the opportunity to kind of give the long form version of your story here.
Yeah, I'm really happy to be here. And that interview with Billboard Chris was like really spur of the moment. So that was one of the first times I was really telling my story. And even for me, it was still kind of jarring to see other people's reactions to my story and hear them be like, wow, that's crazy. That's unheard of. So hearing that also was really like validating for me. So even hearing you say that's kind of nice.
Yeah. So we would love to just have you tell your story here for people who
Sure.
don't know about it. Your story started relatively young, around 11 or 12, if I'm remembering correctly. So tell us what was going on for you around then.
Yeah, so when I was about 11, I started to hit puberty, and I had never had any previous signs of gender dysphoria. I mean, I definitely had somewhat like masculine traits, but it was mostly just that I hung out with boys and I like played video games. But otherwise, I was pretty feminine traditionally. I had no discomfort with being female, but I had been sexually abused when I was in first grade, which wasn't something I ever really processed until I started to hit puberty and started to, actually get context for what happened to me when I was younger. And that just caused me to really have a lot of discomfort about the idea of growing into a woman, or I couldn't picture my future as a female. So that made me think that there was something wrong with me.
Yeah, and you also in the suit you talk about having that experience when you were much younger, and also just having a brother with a disability, I think, which made life at home somewhat chaotic. Can you touch on that? Because I mean, we work with a lot of families, and we know sibling dynamics can play a role in kids' distress.
Yeah, for sure. I've read a lot of articles that have mentioned my brother and got it really wrong. So the
Oh,
context with my brother is that he has really, really high support needs autism, and he has a lot of difficulty communicating. And he is really, really violent in certain scenarios where, he doesn't really understand what's going on or things like that. He literally doesn't know how to ask the question. So he got super violent. And there were occasions where he would be really, really violent around me. Thankfully, I never really got the most of it, but it was mostly my parents. So I was sort of in a domestic violence situation at home around that time. And my brother was, he's about 7 years older. So he was sort of very at a hectic place in his life at around the same time. But he was really acting out when I was around 12, 11. So I was also sort of feeling a bit like I couldn't really talk about my issues with my parents because there was just so much going on at home. And obviously, that's not my parents' or my brother's fault. But yeah, that definitely played a factor.
And did the ROGD kind of explanation ring true for you? That you'd
Yeah,
spent a
definitely.
lot of time. Yeah, sorry, carry on. Yeah.
No worries. I was just going to echo that, yeah, hearing about the rapid onset gender dysphoria definitely rung true to me because I really had no signs until I started actually developing. I just had this like wave of like something is wrong with me. I cannot hate this bad.
So it started out as like a fear of growing up to become a woman. Did you at some point start kind of ruminating on that or looking online? Like your suit talks much more about your experience in the clinic, but I'd love to hear like how did you end up questioning like your gender identity per se?
Yeah, it was sort of traditional, similar to most people. I was wearing baggy clothes to cover my chest and things like that. So I was already playing with gender nonconformity a bit in a way I hadn't before, which, it wasn't really something I was thinking about, but I was also at the time like questioning my sexuality a little bit too, which kind of got muddled up in this as well. But I, sort of just looked up online, like, why do I hate being a girl? Things like that, very cliche. And I was like 11, 12 at the time. So my thinking was very, very naive and childish. So I like was looking up, like, can I actually be a boy? Like, what could I do? Like, could I not be a girl? And obviously, the first thing that comes up is a validating response that this is gender dysphoria and there's a treatment plan and there's a cure. And when I first saw that, I was like, oh, yeah, no, that must be it. Because I've always felt this like deep discomfort with femininity. I just didn't really have the context for it until puberty.
Mm-hmm. So I think at some point you mentioned to like a guidance counselor or a school counselor some of these feelings, which from what I understand, was pretty vague, right? Like what happened? Who did you talk to? Was it like a school counselor?
Yeah, that's how it started. I talked to my middle school guidance counselor when I was in about sixth grade. I had just turned 12. And I was telling her, like, oh, I've been looking into, what it means to be transgender. I've been looking at what it means to be a lesbian, what it means to be bisexual. And I think, I have to be one of these things. I've always really felt weird about being female or that there was something wrong with it. And obviously, this is because I got sexually abused. But, she kind of latched on to the transgender thing because I brought up the like deep seated discomfort. And I guess she misinterpreted that as like, I've always had signs of gender dysphoria, but I never said that. And then I would later tell my doctors I have no signs of gender dysphoria as a child. But she probably assumed that I did, I'm guessing, because immediately after that meeting, I thought I had just gone into vent or whatever. I come home and my parents are like, so you're trans? And I'm like, oh, how did you hear about this? And apparently my guidance counselor had called them immediately after that meeting and said, you have a trans child, you have a son, like you have to talk to your kid about this. And, I sort of felt very weird because I was still musing on all these things. I wasn't really sure, but, I just sort of thought like, well, this is my chance to just get it out. So I'll just go with it. And I was like, yeah, no, I think I'd be better as a boy.
You know what? Sometimes I talk with young people who say things like, my feelings were actually really complex and nuanced, but it's so hard to explain it to people that when someone throws around the trans label, it's just like, okay, that's a concrete way that I can convey my distress with
Right.
my body, even though I know it's not exactly 100%. So it's very interesting because it seems like that was happening. You had this vague series of complaints in the guidance counselor's office, and she just called it this one thing, like, you are trans.
Yeah. I mean, she basically also, she told me she was going to do this, but she spoke to my entire middle school about what it meant to be trans and what a trans child was, and then told the middle school that I was trans and
Oh
that
my God.
I'm going by he, him pronouns now and I need to be called a different name. And she had all of my classmates write me little notes. And I got all those notes back and they were so like naive and childish. And all of them were like, congrats on being a boy and like, awesome that you're a boy now, or like very simple things because I was in sixth grade. But looking back on that, it sort of reminds me of what you just said of like, I was having all these really complex feelings, but as, you know, for lack of a better word, it can be like a pretty complex idea to be trans. As complex as that sounds to like a child, it's actually very simple.
Yeah. So this happens with your parents. Can I ask, what did they say? I mean, were they just like immediately on board, or were they confused when you came home and they said, "So are you trans?" Like what happened next with your parents?
Yeah, my parents pretty immediately were like, really? They immediately were bringing up like how many very, very feminine things I was into, how I liked to wear makeup, how I dressed certain ways. And, you know, I wasn't really like the most girly girl. Like I didn't wear pink all the time, but I was very feminine. And they kept bringing that up. And I kept saying like, well, you know, I've heard that doesn't mean anything about your gender identity and things like that. Because that's what I read online when I first started digging into this, is that, you know, you can be as feminine as you want and you're still actually a male trapped inside.
There's no right way to be trans,
Right.
you know, that thing.
Right. But I very like clearly didn't meet even the diagnostic criteria, but you know, the online results say a very different thing.
So you're having these kind of conversations about your feminine behavior with your parents. Were they still in the kind of apprehension phase when they decided to take you to Olson-Kennedy's clinic to get more help? Or were they like, okay, we're in now, like we're ready to go down that pathway? Like what brought them to that decision to take you there?
Yeah, I mean, they sort of took me to Olson-Kennedy with the assumption that she would like diagnose me out of it. They assumed that taking me to the expert in trans children would make me sort of wake up and be like, oh yeah, right, I'm not. But, you know, that first meeting, she diagnosed me and was pretty sure, and sort of immediately started telling my parents that they needed to be more affirming towards me pretty immediately. And that really scared my parents.
So many parents say that they bring them to the gender clinic, the children, because they think, well, the clinicians, the professionals will look at my kid and say it's blindingly obvious that this kid shouldn't transition. And they go kind of, the parents go in good faith that the professionals will help them. And that's not often, if it's a gender affirming clinic, obviously if once it's a gender identity clinic, it is a gender affirming clinic. It goes very badly awry from that moment on. But for you, it feels particularly egregious. Was it something like less than 40 minutes, that first session with Johanna Olson-Kennedy?
Yeah, and I had only been out as trans, like I was sort of outed. I never even like made the decision myself to tell people. I didn't even tell my parents or any of my friends, but I'd only been out or living as trans for about 3 months by the time that I saw her the first time, which isn't even really the diagnostic criteria for gender dysphoria, nor is that like the time you need to have lived as the opposite sex to be given medical treatment. So looking back on that, I'm just kind of shocked that it was so fast.
So in that first meeting, am I correct in remembering that she recommended puberty blockers after talking to you for like 28 minutes or something? Is that right?
Yeah, it was like, I don't know when in that meeting it was brought up, but it was brought up pretty quickly that puberty blockers was a great option and it's something that you want to get on quick before puberty starts progressing. And there was sort of basically immediately like an aspect of urgency, like you need to act on this now because if you go through puberty anymore, it's going to be really bad. And, you know, I very naively was like excited about the prospect of puberty blockers because I just didn't want to go through puberty ever. So hearing about that was like kind of good in my mind, but my parents were immediately concerned.
But you were 12, is that right?
Mm-hmm.
You were just a baby.
Yeah, I had just turned 12.
Did you and your parents kind of argue about this, or were they trying to kind of protect you from this and they were talking with Olson-Kennedy? Like, was there a lot of debate in your house around these steps?
It wasn't like there was a ton of arguments. There was definitely debate, and my parents were really well-meaning, honestly. They truly had the best intentions. And, right before my guidance counselor made that phone call, they had, heard that I had been doing worse in school, skipping class, like not being as outgoing as I typically was. They had like heard that I was feeling kind of depressed. So when they heard from the doctor that, if I don't get this treatment soon, my depression is going to
Yeah.
spiral. When they start hearing that, they got really terrified and they started doing their own research, but not the most like in depth, but you generally trust like doctors, and most people trust the first couple results they see on Google. And if you look into this, like most of the first results are just, affirm, affirm, affirm. So they almost felt a bit gaslit at the time. Like they knew something was wrong, but they also were hearing from every side in their life that they were in the wrong.
Yeah. And it might be worthwhile to point out, like, Johanna Olson-Kennedy, for anyone who's not aware, she's one of the most well-regarded, well-known gender clinicians in the United States. She received like a $6 million grant to study, gender dysphoria in youth and puberty blockers. Like, she's not just a random physician that is like a one-off. Like, she is one of the leaders of the field. So when somebody like that, who's running this huge clinic, tells a family with a distressed teenager, like, parents already feel really apprehensive when their kids hit the teen years and they like don't really know what's wrong and kids aren't opening up as much. Like, perfectly reasonable that like a top doc tells you, hey, this is the recommended treatment and it will help your child feel better. Makes perfect sense to follow that advice.
Totally. As well as that, I think, when a child is vulnerable and the parents are immediately vulnerable, it's very, very natural for the parents to look for the expert. And they had, like Sasha says, top drawer expert. They had Johanna Olson-Kennedy, the leader of the field. Could you tell us a little bit about the experience of puberty blockers, going on puberty blockers, having your puberty stopped?
Yeah, for sure. So for me, like I had mostly my distress, and sort of what I was originally like going to my guidance counselor about was that I really hated the idea of like growing a chest. And in reality, that's just from a lot of the sexual abuse that I had suffered. But when I went on puberty blockers, a lot of that tissue actually started deforming and looking worse. I mean, not like worse, but just aesthetically a lot different. And I sort of was like overcome with this wave of like new distress of like, oh my God, like this is totally different and I hate this more. But
Wow.
I was also really enjoying the fact of like knowing that I have control of my body fully. But obviously that's kind of an unhealthy thought process. Most people are very okay with the fact that you don't actually control most of your physical sensations. But I was dealing with all this trauma, and I thought that the only way to like, manage it was to control as much of my body as I could. But I'm, a bit appalled that like I had really no gender dysphoria at all, but for some reason, the means that they were allowing me to, sort of enact what I consider a form of self-harm, just for me specifically, on myself, was fully enabled. And I consider the puberty blockers that too, because they just made me so lightheaded all the time because I had no estrogen in my body anymore. So I was just getting hot flashes and lightheaded and just feeling worse, which also incentivized me to go on testosterone faster.
Yeah, it kind of becomes this cascade, right? Because with every medical intervention, there's new drawbacks which propel you on to the next step, which is supposedly going to remedy the negative side effects of like having no hormones, produced
Right.
by your body. So I can understand how that would happen. Okay, so you weren't on puberty blockers very long, if I'm remembering. You started testosterone about what, a year later?
Yeah, about a year later, I was 13, I think. 13,
Okay.
or I was about to turn 14, I believe.
Were you apprehensive about that step?
I was a little bit apprehensive about it. I was a little bit scared about what was going to happen to my body, but I also was like, I would, this is kind of my only option, and I hate being female, so why not? Because I just couldn't. It was sort of like stress to me that I couldn't stay on puberty blockers forever. But it was never really talked about, like, and you could always just go back to female. Like that was never the conversation. It was always like, well, when you want to go off puberty blockers, we're ready with the testosterone.
Yeah.
And it was, it was very weird because I felt like I really only had one option because that was the only like treatment presented to me.
It sounds like you felt like you were on a train or something, that you were on the train and you were just like a passenger almost.
Right.
Yeah, it's interesting too, because when parents are hesitant about puberty blockers, they're often told fully safe, fully reversible, fully safe, fully reversible.
That's what my parents were told.
In all of my work, I've only heard of like 1 or 2 cases out of thousands and thousands where anybody actually does the reversible part. It's always temporary on the way to testosterone or on the way to cross-sex hormones.
Yeah, I mean, just personally, I've never heard of anybody going on puberty blockers without going on cross-sex hormones at some point.
Yeah.
So your parents were told that too, that this is reversible.
Yeah. They were also sort of given the spiel about like, and tons of people just take this and then they go off it and it's totally fine, which I've never heard of and they never encourage. So it was a very weird thing to bring up.
Were they afraid of the suicide kind of issue? Was that big in their mind?
That came up about when I was going on testosterone, is when the suicide thing was pushed a bit more.
Tell us.
My parents were really hesitant about the testosterone, and especially my mom. She was like, that is just too far. I can't handle that. She really, really was not okay with it. But my doctor just kept bringing up the suicide rate and having all these conversations with them that I wasn't in the room for, but just repeatedly telling them about how high risk I was if they didn't agree to this.
And you'll tell us later that high risk behavior actually came after, but tell us. So you start testosterone at 13, injections that you had to self-administer, is that right?
Yeah.
What was that like just initially? I mean, as a kid doing this kind of medical administration?
Yeah, I mean, it was really, really odd. At first, I did not have any problems with it, but eventually I started it got more challenging over time. We can talk about this later because it's after I had surgery, but eventually I even I couldn't do the injections because I was self-harming so much that the injections would make me want to self-harm. So I had to switch to the gel testosterone because I was so bad at keeping up with the injections, but they would rather me keep on the testosterone than be self-harming and not do the injections. They needed me on the testosterone, but yeah, no, it was very weird, the whole process.
So can I ask, at what point did Olson-Kennedy refer you to Susan Landon, that's a therapist? Tell us about that.
Yeah. Susan Landon is my old therapist, and I was referred to her pretty early on. I started seeing her very early on. I'm not sure exactly when, but I believe I was 12 still.
What was that therapy like? What did you talk about?
If
you can share. Yeah,
I can share some of it. Originally, it was very surface level conversations about gender and, how have you felt about being a girl? I hate it. Can you see yourself in the future? What do you want for yourself in the future? And I can't picture myself as a girl. Very surface level things, and talk about who I hung out with at school, if I liked boys or girls better, what kind of things I like to do. Not actual not what you would expect of a therapy session. Certainly not what my parents were thought. My parents thought something very different was happening in those therapy sessions. But yeah, it was really surface level at first. When I got a bit older, we started talking about more serious things. And that's when the therapy got a little even less effective at that point. But just originally, it was very surface level conversation.
And did Susan Landon know about the incident that happened when you were in elementary school and some of the challenging stuff at home with your brother? And did she know about all that?
Well, she knew all about the situation with my brother. So did Olson. My family was very open about there is a very traumatic situation happening at home. This would not be a good time to make big life decisions. My family was saying that from the very beginning, and Olson and my therapist kept saying that that is not relevant.
How did they explain that?
Well, my mom actually had somewhat of a traumatic childhood herself, and she told that to Olson. And
Mhm.
Olson said to her, well, did you ever want to be a boy? And my mom said no. And she was like, yeah, see? And I was later talking to my mom pretty recently, actually, like many years later. And I was talking to her about her childhood. And she was like, yeah, I hated my chest so much. I would always wear big sweaters and big t-shirts. And I hated it so much. And I was like, yeah, so did I. And she was like, yeah, I guess you're right. I never just thought about it that way. Like maybe if I had had the language, I would have thought differently.
Oh. And you've said a couple of times you didn't have gender dysphoria. Well, what would you describe what you did have? I think you have
just,
a little bit, but a
I
little
had
bit more.
normal teenage girl insecurities, and those I think were very heightened by, I have PTSD from what happened to me, and the situation with my brother caused, my PTSD to get even worse. So I have pretty severe PTSD, which like exacerbates pretty normal insecurities. So that's really all I think I have. I went through a lot of other mental health challenges, but now that I've sort of like returned to a baseline where I'm not really on any medication at the moment, I really only have symptoms of PTSD.
Mhm. Sometimes I think about like what I call rumination based gender dysphoria, which is like,
Mhm.
I think maybe that not that you didn't even qualify for the diagnosis, which is so ironic, but to this question about like you did start wondering about being a boy, and that wouldn't have happened had you not found certain concepts and terminology and ruminating about it in the Google searches and then
Yeah,
Olson-Kennedy and Landon. Like it could have just veered in a sex identity based direction as trauma or like all these other
right.
things.
Yeah, I also think like when you have a specific goal in mind, like a treatment goal, that's a really, really helpful thing to think, oh, if I just do this,
Yeah.
it'll all be fixed. But when you have trauma, you're always looking for something to solve it. That's why there's like addiction and all these other, repetitive patterns that come up. But for me, I just use transition.
I've
Mhm.
seen you compare it to addiction, and I agree. It's compulsion. It's very like the addictive mindset on every level. The
Yeah,
escapism, the solution. If only I could get, kind of chasing the dragon kind of idea.
exactly.
I kind of heard you say just earlier, and I thought about it. Like, you were wondering about your sexual development was just about to happen because you were starting to wonder about it. Then you got puberty blockers, which would have stopped that flowering. And then you got cross-sex hormones, which would have kind of, in a way, jags it all up. It makes it very zigzag, I think. I think it really is unfortunate to a child who's just finding their way. Because, you need 10 years, really, to settle into your sexual orientation. And you didn't get 6 months.
Yeah, basically. I'm kind of shocked about it too. Like, I was also sort of told that it was just the same as going through any normal puberty by Olson-Kennedy. Like, there's no difference. It's basically the
Mhm.
same. And, now that I'm off all these hormones, I am shocked at how much is changing about me and about my body and the way that I think and how much I missed out on. And it's all
Yeah.
sort of hitting me now.
Mm.
Wow.
Yeah, it's remarkable. So when you got on testosterone, I know you said, initially the injections were really challenging, but what started to happen just biologically, emotionally, mood-wise when you got on this they're trying to approximate male levels of testosterone. Tell us about that.
Yeah, so just like the basic first physical changes that happened, my voice dropped, I got an Adam's apple, I got tons of facial hair, and like I got body hair all over pretty much. My whole body redistributed as well. So my shape is it's still pretty kind of masculine, but it's changed a bit. But originally it was much more masculine. And I started like pretty actually. I'm, I passed really well at the time. It's kind of shocks me now because I don't really pass as male anymore. But at the time, all my peers started recognizing me as male. And then emotionally at the same time, I was sort of being thrown through all these mood swings. I was super angry all the time. My libido was like uncontrollably high. And just that really freaked me out because I didn't really know what to do with that. And I was really, really intense all the time. And I just couldn't cry. I couldn't feel emotions the way that I used to. But then at the same time, like I'm getting all this positive feedback from my peers and I'm, fitting in better at school. So it felt better, but it was a lot worse.
And how long were you on testosterone before you kind of started thinking about the next step, which was surgery?
I guess I was on testosterone for a few months until I got the letter for surgery because I started testosterone, I believe, the winter of 2018, I think. And then I got surgery May of 2019. I think that's correct, but I know surgery was definitely May of 2019. So it wasn't a long period of time.
Okay.
Were you using a binder before that?
Yeah, I was using a binder sometimes, but I also, because of the like deformity from the puberty blockers, I didn't really need to. So it was only if I was wearing something like tight.
So the puberty blockers did deform, you felt they deformed your chest?
Yeah, because I only had breast buds at the
Yeah.
time that I went on puberty blockers, so I didn't actually have enough breast tissue to really, to
Yeah.
actually even be considered like a fully developed chest. But when I went on the puberty blockers, it just sort of deflated. So it was very like odd looking.
Oh.
Were you distressed about that
I was
before you
very
had
distressed
surgery?
about it. Yeah, that's what made me want to get surgery so quickly was because of the changes in my chest.
And you had some really complicated mental health worsening. Was that between the testosterone and surgery, or was that after surgery?
It was after surgery. I had sort of gone through another traumatic experience, which I had talked through with my therapist at the time, Susan. She didn't know the extent of the abuse, but I had, been in an abusive situation with somebody and I got sexually assaulted again between the time of me being on testosterone and me getting surgery. It was around like March of 2019. And I was cleared for surgery, but obviously the surgery was definitely in reaction to what had just happened. Then immediately after the surgery, suddenly I was confronted with all of the trauma from what had just happened. And I was very, very like mentally not okay. But only once I was like fully healed from surgery, I started to like really spiral and I started like using drugs and doing things that were pretty crazy.
Mm. You were so young. I mean, I'm also just thinking about something kind of logistical. Like, were you in school during all this time? Like, I could just imagine you're going to multiple doctor's appointments. I mean, healing from a surgery at 14, that is a huge task. How did this impact the other aspects of your life?
I remember I went on a school trip and it was a couple weeks after surgery, but it was like I think it was my 8th grade like trip and I couldn't participate in any single activity because I was still healing from surgery and I just had to sit and watch. It was very awkward. And, at the time didn't really register how depressing that was.
Did your friends know? Like, did people know what you were going through?
A lot of people that knew me before knew what I was going through and were actually kind of a bit concerned, but a lot of people had no idea and just assumed I was male.
Mm. Okay. So you have this surgery and then things start to get really bad. Like in the suit, it says that you started kind of struggling with really serious things like hallucinations and really serious suicidality and self-harm and even an attempt. Like, can you just tell us a little bit about some of these really challenging mental health things that started to happen?
Yeah, it started with really significant anxiety, like I couldn't fall asleep at night because my heart was beating so fast, or I would run a lot and work out a lot, and I couldn't stop. Like, I just had to keep going. I was so energetic at night. Like, I would run at night all the time. And it started with things like that, but it eventually turned into like full blown, I was showing symptoms of paranoid schizophrenia. I was having full visual and auditory hallucinations. I was having the same sort of restlessness, but it was accompanied with all these like auditory hallucinations. And I started engaging in delusional thinking where I thought I wasn't even human at a certain point. I had a couple months where I was like full solipsist, and I truly thought like nobody else in the world existed. And I was convinced that I didn't even like have blood or like anything. So that's what got me really into self-harm.
Because what helped you feel like sensations? Like what happened there?
I was really, really psychotic, and I truly did not believe that there was anything inside me.
Wow.
Yeah, it wasn't even like I wanted to feel something. It was like I truly thought I had to do it. And throughout this whole time, I was seeing psychiatrists. I was keeping my therapist updated. Everybody in my family knew. Never once was it brought up to go off testosterone. It was always try this psychiatric drug.
Yeah, can I ask about that? So like as I was researching the suit, it seemed like you started seeing a psychiatrist, but like outside of Olson-Kennedy's clinic, right? Like it was an outside provider. Did he ever say, hey, maybe this transition that you're going through is harming you? Like, did he ever consider that maybe this isn't working? Because he wasn't really a gender clinician per se. So did he have any insight about this?
No, he was a very standard child psychiatrist that dealt with psychosis all the time. And he never once even questioned the testosterone prescription. I mean, I was having really, really paranoid delusional thoughts and talking to him about complex paranoid beliefs that I had. And, I was also living as a male and telling everybody in my life I was biologically male. And, for some people, that's not a sign of psychosis. But at least for me, I just consider that another aspect of my crazy thinking at the time. But that part was never questioned. I was just like treated as a male.
You're just a male patient that he's seeing for psychosis. Uh-huh.
Was it around about then that you said, like, at first you were injecting the testosterone and then you said you were self-harming, and you said it was like a trigger, the like injecting the testosterone? I've heard enough detransitioners to say they started to dread the injections and things like that. Could you tell us about the arc of that?
Yeah, I definitely started to dread it a bit. And I was also having these really, really paranoid thoughts about my body and like literally the nature of my consciousness. I was like truly believing I wasn't a person. So having to like actually inject something into my body was nightmarish to me, and it would make me start self-harming when I had to do it. So the suggestion was to go on the gel testosterone.
Wow. Okay. So this is really complicated because, it's in some ways it's so simple and so obvious, but in other ways it's very complicated because you had a very broad number of severe mental health complications at the time, right? Which are going to call for the attention. Like if you have a patient who's self-harming, that is going to be the big priority. And like I hear a lot of times in conversations with parents or even other therapists, sometimes there's so much going on that they say gender is the least of our concerns. Like we're focused on this. So obviously it's a bit different because you were taking a substance, which was a gender related intervention. So we should think about that. But I can just imagine like how, if you list the 10 complicated things you were experiencing, being trans almost feels like a throwaway at that point.
Right. I was never even thinking about it myself as like a possible aspect of my mental health issues. I didn't even consider it a problem because by this time when I was in psychosis, I had already fully transitioned. I had spent about like 3 years at that time living as a male. All my peers knew me as a male. So I just never thought about it.
At what point did this start to become a question for you? I know that there were some things that happened around 17, but how long did it go on that you were having these complicated mental health issues and you didn't really think the gender had anything to do with it?
That's a really complicated question because like I only stopped testosterone earlier this year.
Wow.
Like I had been on and off for a while, and then I was like slowly weaning off, and I finally decided to stop this year. And I had sort of come to the conclusion like, oh, I must be non-binary. And then after I stopped the testosterone, I really like was looking at my life in the mirror, and I was like, what is making me say that? Why am I clinging to this idea? So it really took till about this year, I would say, like to fully desist or detransition or even question it.
Do you mean last year, 2024?
Yeah, 2024, not 2025.
Yeah. It's something you said something very interesting earlier, and I think it is a very important point. When somebody's puberty is stopped and then they are diverted onto another road, which is testosterone, and you go into a chemically induced other state, which isn't puberty, because puberty is your natural biological, the awakening of your reproductive system. That's not what's happening. There's a chemically induced kind of pseudo kind of experience happening with testosterone. And then ultimately you stopped that maybe a year ago. And so effectively your body is now going through what it should have gone through all those years ago. And it'll take some, because it's a very unfolding process. That's kind of mind blowing. I hadn't thought about that very much.
Yeah, I mean, it's been really, really odd, honestly. Like, I have had so many moments where I have feelings or thoughts that I would have never thought before. And that's something you don't really consider with hormone stuff, but people definitely acknowledge that there is some emotional effects. And I don't know anything about the science. I'm not a doctor, but I've just noticed it in myself. Like, for example, I never wanted I would want kids, but like I would never look at a kid and have like an emotional reaction. Now I look at babies and I'm like, oh my God, like I start getting emotional and or things like that. Like I just cry at movies all the time and stuff like that. And I didn't think that was something that would bring any value to my life, but it really actually has stabilized my mental health in a huge way.
That's huge. Can you say more about that? I think that's really profound.
Yeah, for sure. I mean, I think when I was first like told about female puberty, it was always like, and it's so awful, you get so emotional, and it is the most worst nightmare possible. So I was terrified about like, oh, if I ever get estrogen in my system, it's gonna be nightmarish. It's gonna be the worst. But when it actually happened, all these like emotional mood swings have really brought me so much insight. Like I've learned a lot about myself, and I've learned where my emotions are and what makes me feel certain things. And I think that's really valuable to actually have that emotional intuition. And I feel really like kind of robbed that I didn't get to discover myself with that level of just chemical emotion.
Oh, I couldn't agree more. You were completely diverted off onto another road that was chemical.
Yeah.
Yeah.
That's actually a really important point, and I don't hear people talking about it much, but I've thought a lot lately about this kind of amazing thing that females experience of this like cyclical change in our perception, our energy levels, our mood.
Yeah.
And it is often talked about like being a woman is so hard because our periods are so gross. Like that's the common narrative. And it's not that there isn't some truth to that, but there's so much more to some of these biological changes that females experience that are actually quite incredible once you learn to
Absolutely.
tune into them and like accept that they're happening and not fight
Right.
it. So where were some of those ideas that you had of like, if estrogen happened to me, that would be terrible? Was it more related to like the gender stuff? Or are you just saying societally, like most little girls are terrified of becoming, women and getting periods and stuff like that?
I definitely like had that impression from societal input for sure. I think most like girls have had that thought. But I think it was also like once I got on puberty blockers, it was also very like just it was almost described to me like female puberty would be the worst case scenario.
Yeah.
So also after I got on puberty blockers, it sort of became more terrifying to me. And I remember like, I got my first period at like 18, and I emailed my doctor like panicking, like as if something was truly, truly wrong with me. And I like thought I needed to go to the hospital. And, it's so weird to think about, but I really just like stunted myself so much farther than I needed to. And all these things that I thought would be terrible for me have actually been great value to me and my mental health.
Well, highly qualified clinicians stunted your development. That they are definitely the people who should be in the firing line. I kind of think as well about the way you were diverted from your path. Did you know anything about, like, I have my own perception of Johanna Olson-Kennedy for years, and she was famously somebody that had been recorded as saying, well, if if they want boobs in the future, they can get some. Had you heard any of this? Like, it's a dreadful video, and I'm sure we'll put it in the notes, but she's so flippant and cavalier about an extraordinarily huge event in your life and many. How many patients has she? 1,200.
That's what I understand. Yeah.
Yeah, and she has this kind of flippant point, well, if they want boobs later, the breasts later, they can get them. As in, they could have a boob job or something. Just utterly dismissing the entire experience. Had you heard any criticism of her? Like I say, she was kind of devil woman in my world. Had you heard anything problematic about her?
I had heard about some of it, and I had been told all of it is transphobic and bigoted and right wing, and I should not look at it, and it's just propaganda. So I never looked at it. But, I didn't even see that quote until after I had sort of had my regrets about it. And don't even get me started. That quote like infuriated me. And as somebody who's actually gone through like getting implants after having a mastectomy, it just like there's no words to describe how insanely flippant and redundant and stupid that quote is. Like I can't. I've cried over that for nights.
Can you tell us a bit? I mean, I'm sure there's no way you can fully convey everything you've been through, but like, what is it that she's not getting? I'm really baffled by her because I genuinely believe there are probably lots of people that are like, oh my God, you're the best. Like, I'm so much happier now. But she's totally blind to the potential of danger that she's operating under. So like, what is it that what do you want to say about that, about her quote, about her flippancy? What do you want to say about it?
I think that, I think she is truly, my interpretation is that she was willfully negligent and, not doing the proper checks on me. Not because she's a horrible person and a demon, but because she like truly believes she's right. I don't know how she has come to that belief, but I think like just from speaking to her and being her patient and having met her before, like I don't think she's truly like evil deep down, but what she has done to my life is truly like, I don't want to say I've ruined my life because I have a whole life ahead of me, but it does feel that way at times. And I've cried over this for nights and I've lost sleep over this for nights. I've literally lost 8 years of my life to a person I created to run away from my childhood sexual abuse. And, when I look back on the facts of my case, it is so glaringly obvious. And, if you are a trans kid, whatever that means, or you are a person who would have grown up to be a transition person otherwise, and you meet a doctor who will give you whatever you want, I'm sure that person is amazing to you. But when you're a doctor and you're treating patients, you have to treat every patient as an individual, not as a gross ideology that you want to categorize and study and talk about as all one unit. We're all individual people with different needs.
Yeah.
I just feel like my case specifically, I am shocked. Like truly, I had zero gender dysphoria. I was like textbook kid who got molested, and it was just not talked about.
Yeah.
Have you ever contacted her or anything, or have you ever gone back to Susan Landon or that first guidance counselor in the school who really kind of ran with the ball very fast?
Yeah, I reached out to Olson-Kennedy a while ago. after I had stopped seeing her and I had started seeing a different doctor who was overseeing me stopping my testosterone. And I asked Dr. Olson-Kennedy for a bone scan, and she had asked me about it, and I had responded, and I just let her know like what was going on. She never got back to me. So, even like a very just clinical message, like even that was ignored. So I don't really, that was obviously before the lawsuit or even my detransition. I was just identifying as like non-binary at the time. But, even that was ignored. So as much as I'd like to reach out or have something said to me, there's been nothing.
I think there's just a couple other things I want to make sure to highlight about your story, Clementine. Something very interesting in your suit was that all of your mental health difficulties, the ones at least acknowledged by Olson-Kennedy and Landon, were said to be caused by things like minority stress theory, or like you're jealous of cis men, or like body hatred is normal for trans people. Can you just talk a little bit about how they made sense of your very obvious decline?
It genuinely stumps me sometimes,
I know.
especially when I was in the throes of psychosis and it was just, are you taking your testosterone on time? No? Okay, we need to fix that. Like it wasn't even a concern. I mean, it's in the lawsuit that she would not even write down me talking about my mental health problems. She wouldn't even write it down. She knew it was happening and she would just write anxiety in my notes at around the time I was 17, where my other doctors were writing all about how I never slept at night, how I was constantly cutting myself, how I never went to school. So I don't know. Like I don't know how they made sense of it.
I want to just be clear about this because, like, as I was doing the videos that I mentioned, I'm doing these kind of analysis videos of the story.
Yeah,
that
I've seen
wasn't
them.
super clear. Oh,
Yeah.
so I'd like to hear your thoughts another time. But okay, so Olson-Kennedy actually knew for sure about those specific mental health complications.
Yeah.
She just chose not to put it in her notes.
That's the thing. Yeah. As I would talk about it, she knew about it. It just wasn't in the notes. And, I was very open about what was going on. It was just written off as anxiety because I don't know. But, you can see the medications I'm on are in those notes too. And,
Yeah.
I'm not on high doses of Seroquel and hydroxyzine at the same time for mild anxiety.
Yeah. Wow. And that really just goes to show, this is like a theme that came up in the upcoming video, like promoting gender affirming care is more important than ethics and facts. Because,
Right.
She always talks about how, you wouldn't ask a person with diabetes for a mental health assessment before you give them insulin. Like she says these things as though she thinks mental health has nothing to do with it. But it's not, there's no reason she would have omitted all of those serious complications if she didn't think that actually it does matter. She's just like, I don't care. I'm bulldozing through my caseload and it doesn't really matter. I'm going to hide the complications because I know I have to know that this actually does make a difference. Otherwise, I would say, like, I'm happily prescribing testosterone to a person with psychosis. Like, why wouldn't you say that if you really believe it?
Or like, I can't speak for her. I don't want to talk about her intentions, but it just, to me as a patient, looking back on it, I wouldn't expect like a normal pediatrician to not write something as significant as psychosis, even though it's being treated by other doctors. I still feel like that's something you'd want to include. And even if, let's say, like the premonition of like a, trans child is true, I did not fit that definition at all. I was having all the worst symptoms of that. So, even if I was with a cohort of, children who truly needed to be medicated with cross-sex hormones, I would have been the person that should have been taken off those hormones. So that's what like confuses me the most, is that if theoretically I was one of those trans children, I was having that bad of complications, you would take me off that medication if it was any other medication.
So you were on testosterone for about close to 5 years when she started talking about hysterectomy with you.
Yeah, I was around 17.
What happened?
We just started talking about, college and plans for the future. And it was just brought up pretty casually and as something that I would need to do at some point soon because of how long I'd been on testosterone. And just for me, that was like a real, for lack of a better word, a wake up call of just, I can't do that. Something about it just felt like very too far to me.
Was that when things started to crack in your mind about the whole idea of like being a trans boy, or like was that it, or had it started earlier?
Honestly, no. I just like I was more thinking about what am I doing to my body and at that point I had gone through mental health treatment about my trauma, so I was starting to question if my actions towards my body were about my trauma, but I still wasn't really like ready to um face the fact that I wasn't trans. Like it was the sunk cost fallacy thing of like I
Yeah.
couldn't
Mm-hmm.
even question the idea that I wasn't really a boy.
Can I ask, when were you still working with Landon when you started getting trauma therapy? Like, can you talk to us a bit about your therapy timeline?
Yeah, I stopped seeing Landon just because by the time I was having more complex mental health struggles, she just couldn't help me. She would attribute a lot of my problems to gender dysphoria, which didn't really make any sense because the only dysphoria I really had was about my chest, and that was gone. So I I just didn't think that there was any point in investigating my gender dysphoria anymore.
And you
I
were like
also,
passing as a
yeah,
boy, right? Like you were living as
right.
a boy and passing as a boy.
Yeah. It didn't
Mm-hmm.
come up in my daily life at all. I didn't want to talk about it anymore, and it was something she would keep bringing up. So I just, was seeking a new therapist, and I had been talking to my psychiatrist about my trauma more, and he suggested I do more complex trauma therapy.
And can I ask, like, from the age of 12, when you were distressed and wondering, and then you kind of got spiraled into this extraordinary fast track into, medicalization and, testosterone and then mastectomy, and then you were spiraling with psychosis. Did anybody understand you? Did any of these mental health clinicians, for example, bring up the being molested as a child, or did anybody hear you and say, "Yeah, are you okay in there?" Or was it continuously in those 5 years pretty superficial care?
It was very superficial until I saw that other therapist. Um, with my psychiatrist, we talked about the trauma, but it wasn't really like a holistic view of my other symptoms in reference to them. It was just what happened.
So when you started going to this other therapy, am I remembering that it was a DBT therapist, something like
Yeah,
that?
it was, I believe it was DBT and imaginal exposure therapy were the two
Oh
types that I did.
yeah.
Okay. So can you tell us a little bit about starting that? I presume that this would have been a very different experience than all the other types of interactions you had with providers. Like, what was that like going to this therapy that is like there to focus on trauma?
Yeah, it really shocked me at first that we weren't just gonna like talk about my day. And what I really liked about it was that there's like a very kind of mechanical aspect to DBT of like you fill out the worksheet about your emotions, then you can read it and see the chart of how your emotions and how your brain works. So I really liked that because I sort of have like a bit of a one track mind and like I like things to have a very clear answer. I think that's why being trans was something I didn't want to give up. And I was very like, I'm going to do this. Even when I knew it wasn't working, I still wanted to like cling to it because it just felt like a good answer. But with DBT, it was awesome because it was still this very kind of weird mechanical framework for very complex emotional intervention, essentially.
And what did you start to learn in the process of doing this kind of systematic therapy?
Yeah, I think the biggest thing that I learned was that I had, shaped a lot of my identity and a lot of my decision making around fear and around other people and what I thought other people wanted of me or what I was afraid of other people thinking or what they would do. And you would think that would obviously bring me to the conclusion of I'm not trans, but it still didn't at that time. But that was sort of the main takeaway, was that a lot of my decision making was purely just PTSD responses.
And you said that if you had that kind of therapy at the outset when you were like 11 or 12, you don't think you would have gone down this gender identity road.
No, I truly believe that. Like, if I had been told that it's a possibility that I am just female and I'm just uncomfortable and that I have a lot of stuff going on, if I had just been told that, I don't think I would have done all of this. But the trauma really, really warped my brain. And the way that they were describing gender dysphoria fit all those same criterias as, you know, being trans. And that big overlap sort of confused me a bit, because I was about like 6 or 7 when I was originally assaulted. And that really sort of gave me this constant feeling of like, I'm not a real person, or there's something wrong with me, or I've just this like, just a pit of guilt like sinking on my chest. And when I like talked about that feeling to my guidance counselor, I think that was something she associated with the trans experience, or that's something that is very common for all types of mental health struggles, that is like seen as, you must be trans if you've always felt there's something wrong with you.
Well, the fact that you're sitting here talking to us about a lawsuit re-identified as Clementine as a woman is remarkable, because all of the odds were stacked in the favor of you just being trans long term. What happened? How did you start to see things very, very differently?
Yeah, I mean, once I got through the original period of like quitting testosterone, which was really, really hard to do, like I kept weaning off of it, and then I'd go back on, and then I'd go off and go back on. But when I actually finally was able to detox for a couple weeks, no testosterone, and get my levels somewhat close to regular, I started noticing like my anxiety was gone, my insomnia was so much better. I wasn't restless all the time. I just felt so much like clearer headed. And at that point, I was just like, why am I doing this? What am I gaining from this? And at that, at that realization of there's literally nothing I'm getting out of this, I'm just doing this because I've been doing it since I was a kid, that really like just shook everything for me.
It must have been horrifying.
It was, especially like, at the time, I look a lot different now. I mean, my face has changed so much just over the past year, but when I first went off testosterone and like I had that realization, I'm looking in the mirror and I'm like covered in facial hair, my face looks different, I have a flat chest. It was like, I don't know, it just felt like I was seeing a whole different person for the first time.
Wow. That's really amazing. Oh my God. So at what point did you tell your parents that you were having that thought? Like, was it immediate, or did you take some time to reflect on it? Did you have friends to talk to? Did you tell your therapist? Like, what happened?
Yeah, it took a couple months for me to come out about it to my parents. And, I hadn't even had the original conversation with them. So this was actually my first time coming out.
Wow.
And it was so weird and awkward because I had never even done it the first time. So I just had no idea what to say. But obviously they were very emotional about it and very shocked. But I had also had a couple of months of like talking to my friends and talking to my significant other about it and working through it in my head before I actually told my parents.
Wow, Clementine. I mean, this is an amazing story, and I'm so glad that you were able to share it here. We'll continue to talk maybe about your relationship. I'd be really curious if you'd be able to share a little bit more in the extended conversation. But for everybody listening on the podcast here, is there anything else that you'd like to share with our listeners?
Not specifically. I think I said a lot, but I'm really grateful for this opportunity, and thank you for having me.
Thank you. I'd like to ask, just before we close up, just because I speak a lot with detransitioners, and there's a lot of angst and worry and anxiety around reconstruction. Would you share a little bit about that? Because I know it can feel really frightening. God, another medical intervention. Should I do it? Should I not? It seems to blow people's heads off, understandably. But have you anything to add to that kind of thought process?
Absolutely. Yeah. I had a lot of those same feelings and I was really terrified. I mean, I didn't sleep the night before surgery, and I was having so many like, oh my God, am I making a terrible mistake again? And I didn't have those thoughts when I got top surgery. I slept like a baby the night before. But this time around, I did so much research. I was terrified. Just the thought of having implants and getting them replaced, it just really sounded kind of awful to me. And then the second I woke up, I was like, this was the right choice. Like, I immediately felt more adult, more comfortable in my body, even though it's definitely not for everybody. For me specifically, it just really, really healed something deep within me where I had been avoiding seeing myself as a woman for so long. And I had never seen that in the mirror. So actually getting to see that for the first time, even if it is fake, technically, it was really, really wonderful. So for me, it's been great.
Thank you. Thanks so much for sharing
Thank you, Clementine. Yeah, it's been amazing.
Yeah.
Thanks for joining us this week on Gender, a Wider Lens.
If you enjoyed the show, please rate and review us on Apple Podcasts or Spotify.
And be sure to visit us on Substack by going to widerlenspod.com. There you can join our listener community, access bonus content and resources, plus learn about additional ways to support the show.
Our discussions are for educational purposes and are not intended as a substitute for mental health services.